We hope you enjoy our presentation on renal calculi, presented by Joseph, Christy and Jamie. Peter is a 33-year-old male who presented to the emergency department with a complaint of pain in his lower back, pointing to his flank area. Peter stated that the pain had started earlier this evening as a dull bearable pain, but had since increased to a sharp pain and would rate his pain now as a 7 out of 10. He mentioned that since the pain had increased, that his nausea had also increased. To relieve some pain, Peter had taken some paracetamol at home, however he had little relief. After further questioning, it was established that Peter was experiencing some pain when urinating, and that was making him hesitant to urinate. He also mentioned that he thought he noticed some blood when he last urinated 2 hours ago. Peter lives with his wife and 2 children in a small country town. In the last 6 months, he has gained a bit of weight, and he has put this down to a change of jobs. As he said, he and his family lived a relatively active life prior to his job change, as well as eating a reasonably healthy diet. Peter had been made redundant from his job as a plumber and is now doing shift work, driving trucks for a living. Therefore, his activity levels have suffered along with his diet. Peter is slightly overweight in appearance. He eats on the road and tends to eat foods that are high in fat and drink sugary soft drinks. Peter doesn't smoke. He is not on any medications, nor does he have any allergies. Peter has not had any complaints or admissions of renal calculi. However, it was established on further questioning that his mother had had a history of renal calculi.
Renal calculi, also known as nephrolithiasis or kidney stones, are small mineral deposits that crystallize, forming a hard stone-like object. These stones develop within the kidney or the surrounding areas of the renal system, with the specific chemical composition of a given stone depicting which category or class of stone they fall into. This condition is often referred to as one of the more painful medical conditions that a patient can present with, and as such, the associated pain, known as renal colic, if left unmanaged, can become unbearable. These stones are comprised of several different minerals, and the basic makeup of the stone allows for their identification into one of the multiple subtypes. These differing types of calculi require varied interventions, treatments, and further management, and as such, it is vital that healthcare workers are knowledgeable about their patient's specific presentation. Some forms of renal calculi have been classified into the following: calcium oxalate stones, struvite stones, uric acid stones, and cysteine stones. The prevalence of calcium-based stones is far higher than that of any other subdivision, as depicted by the approximate 80% of renal calculi presentations having a calcium-based foundation. More specifically speaking, however, calcium oxalate is seen to be the most predominant when compared to calcium phosphate, as it alone accounts for 70% of this. Renal calculi, or kidney stones, can develop within and affect any part of the urinary tract. The vast majority of stones are formed within the kidneys themselves in areas such as the renal tubules and calyces. These specific stones are referred to as upper urinary tract stones. Some stones, however, may be formed within the ureters or the bladder, and these are referred to as lower urinary tract stones. The definitive cause of kidney stones at this stage remains largely unknown, thus requiring further investigation and research. With this said, however, a large field of risk and contributing factors have been identified which allow healthcare workers to place focus on the prevention of occurrence or, in some cases, reoccurrence. These factors include not only those which are predisposed to a person, but also draw on several environmental and social aspects of life, making psychoeducation vital in reducing the incidence of presentations. Some of the intrinsic factors to developing nephrolithiasis include gender and age, as well as several medical conditions such as hypercalciuria and short bowel syndrome. To elaborate on these risk factors, it has been proposed that men have a significantly greater chance of developing the condition than women, with the likelihood and the risk of this peaking at the age of 70. Furthermore, conditions such as short bowel syndrome in turn often result in the development of health problems including hyperoxaluria, which has a strong correlation to the progression of kidney stones, and as such holds a heightened risk of renal calculi. In addition to these factors, several controllable factors relating to a patient's lifestyle are further said to play a large role in the development of the condition. These are inclusive of a decreased fluid intake, high salt diet, and finally, weight gain and an increased body mass index. Factors such as weight gain and high salt diets are especially relevant when accounting for the case presentation at hand and are seen to increase risk due to discovered links with higher body fat percentages, insulin resistance, and the supersaturation of an individual's urine. Calcium stones develop in an individual's renal system when the urine becomes supersaturated or holds an extremely high saturation of several components. In this case specifically, calcium and oxalate. This supersaturation means that the body's capability to filter a given product has been outweighed by the sheer quantity of the product itself, thus meaning that the body's systems become overwhelmed and are unable to return to homeostasis naturally and cannot counter the level of calcium oxalate in the urine. At this point, homogeneous nucleation will occur, allowing the individual calcium and oxalate ions to bond together. They will then eventually form a small crystal before the chains are further developed, and following this, the crystal in turn becomes what is known as a calcium oxalate stone. Several inhibitors and catalysts may play a role in the rate at which this process occurs. However, the condition is often not identified clinically until the body has completed these processes and the stones are fully matured. Following these processes, the stones are regularly able to pass through an individual's urinary tract asymptomatically and without issue. However, it is once complications begin to develop that the condition may further lead to more detrimental outcomes. If left untreated, renal calculi can become a potentially life-threatening condition in which a patient may experience chronic urinary tract infections, blockages which may lead to the eventual rupture of a structure, as well as tissue damage, kidney failure, and in the most severe cases, even death. With this in mind, however, even after treating the condition in question, several unpleasant complications may arise. These adverse events may include recurring episodes of renal calculi, which are in turn more likely to require an increased level of intervention, such as surgical removal, infections, and heightened risks of developing several conditions such as renal disease in the future. The patient within this case study, Mr. Peter Pan, can be identified to engage in several of the environmental risk factors associated with developing renal calculi, as well as a limited number of intrinsic risk factors. Peter is a 33-year-old male, which alone predisposes him to a higher likelihood of developing the condition when compared to females of a similar age bracket. Alongside this, which is out of Peter's control, he also engages in an unhealthy lifestyle with limited physical activity, recent weight gain, and a subsequently increased BMI, as well as a poor diet consisting of foods of convenience, often high in salt and fat content. All of these behaviours place him at a heightened risk for the occurrence of renal calculi, and as such, following treatment, it will be vital for his health professionals to provide psychoeducation on how he can better prevent any subsequent episodes of kidney stones in the foreseeable future.
NSQHS Standard Number 4, Medication Safety. Ensure competent clinicians safely prescribe, dispense and administer appropriate medicines to informed patients and carers. Safety criteria includes governance and systems for medication safety, documentation of patient information, medication management processes, continuity of medication management, and communicating with patients and carers. Standard number 9, recognising and responding to clinical deterioration in acute health. Ensure a patient's deterioration is recognised promptly and appropriate action is taken. Safety criteria includes establishing recognition and response systems, recognising clinical deterioration and escalating care, responding to clinical deterioration, and communicating with patients and carers. Before arriving at the ER, Peter had been taking paracetamol for his pain. Paracetamol is a non-opioid analgesia, and it is a great first-line pain reliever for mild to moderate pain. It is not exactly known how paracetamol works, however, it is believed to reduce pain signals to the brain. Side effects associated with paracetamol include hypoglycemia, rash, jaundice, and hives. Contraindications of paracetamol include hypersensitivity to paracetamol and severe liver dysfunction. Safety and monitoring considerations associated with paracetamol are monitor and use with caution in patients with liver dysfunction, monitor the patient's vital signs and assess for pain. Patient education should include side effects associated with paracetamol as well as signs and symptoms of hypersensitivity and/or drug toxicity. Educate the patient on the importance to avoid excessive consumption of alcohol whilst taking paracetamol and their prolonged use without medical advice, as it can increase the chances of drug toxicity and potential dangers to the liver. The patient should be informed that to avoid overdose or liver damage, the patient should not take any other medications containing paracetamol. Peter may be prescribed a thiazide diuretic. This is used to reduce calcium excretion along with preventing the reoccurrence of calcium stones. Side effects include dizziness, vertigo, orthostatic hypotension, nausea, anorexia, vomiting, dry mouth, diarrhea, dehydration, polyuria, nocturia, muscle cramps or spasms, hypercalcemia, and hyperglycemia. Contraindications of thiazide diuretics include renal disease, hypersensitivity to a thiazide diuretic, and electrolyte imbalances. Safety and monitoring considerations include monitoring the patient's vital signs, especially blood pressure, due to the side effect of hypotension. Monitor the patient for signs and symptoms of hypersensitivity. Monitor serum electrolyte levels and any signs or symptoms of an electrolyte imbalance. Monitor blood glucose levels, as prolonged use can increase levels of blood glucose. Monitor urine input and output due to polyuria and renal disruption. Patient education would also include side effects of the medication and to advise the patient to take the medication with food to avoid gastrointestinal upset. Take the medication in the morning to avoid nocturia, to rise slowly from sitting or lying position to avoid orthostatic hypotension, and prior to taking non-prescription medications, to discuss with a healthcare professional first. Peter may also be prescribed potassium citrate. This is used as an alkalizer to manage calcium stones by increasing urinary pH to prevent crystallization, as well as increasing the potassium citrate levels lost whilst taking the thiazide diuretic. Side effects include abdominal discomfort, nausea, vomiting, diarrhea, hyperkalemia, and cardiac arrest. Contraindications include hypersensitive to potassium citrate, electrolyte imbalances, specifically hyperkalemia, uncontrolled diabetes, dehydration, renal failure, urinary tract infections, and gastrointestinal ulcers. Safety and monitoring considerations include monitoring the patient's vital signs, as well as monitoring for signs and symptoms of an electrolyte imbalance. Patient education would include the side effects of taking potassium citrate, to administer with food to avoid gastrointestinal upset, discontinue and seek medical advice if stomach cramps, severe vomiting, or gastrointestinal bleeding become present. Advise the patient to drink 2 litres of water daily, and the ongoing monitoring required of the patient's serum electrolytes, creatinine, and full blood count.
Hi, my name's Joseph and I'll be discussing the nursing interventions for Peter. Initially, the nurse will start off with an assessment once Peter does come into the hospital. This will include a health history, which establishes report. reduces social distance, and also finds any previous family history of renal disease. And in this case, Peter's mother did have renal calculi. Next, the nurse will be conducting a physical assessment. This is it will be a continuous physical assessment which is required to monitor any changes to report to a doctor, and it also allows for holistic care towards Peter Piper. And it also will be used to monitor to detect any infection or worsening conditioning for Peter, because it does establish a baseline. Investigations prior to management. Initially, the nurse would need to conduct some tests to make sure that renal calculi is the correct diagnosis. There are a variety of tests a nurse can utilise, such as a urine test, an ultrasound, an X-ray, analysis of any stones if they are already passed, and which a strainer can be used to catch these. And as you can see in the image to the right, those are some different types of stones that what they do look like, and see the top left is the calcium stone, which Peter has been alleged to have. And finally, the blood testing can be also another test in which calcium levels are tested in blood. A renal ultrasound would be the best option for Peter to test for the calcium stone. It is used to analyse the type of stone, in which in this case it is found out to be a calcium stone. And it also doesn't expose Peter to any radiation, which means it is safe. And results are also quick and take only about 30 minutes, which is good in the acute setting, which means the nurse can conduct the management stage as fast as possible. Lifestyle alterations. Initially, Peter needs to make alterations to his diet to reduce the chance of further complications of any kidney stones. This will include a reduced consumption of animal protein and salt, as well as increasing Peter's water intake. Thirdly, using caution with calcium supplements. And finally, alterations Peter can make to his diet is reducing intake of oxalide-rich foods, such as spinach, sweet potatoes, nuts, and soy products. Other lifestyle alterations that the nurse will try to get Peter to make would be an increase in his physical activity levels. Peter is most prone to kidney stones because he does stay sedentary for a long time due to his job. And this is leading to the bones releasing more calcium because he isn't very active at the moment. So in this case, even low amounts of exercise will be beneficial to Peter. And so the nurse will stress that even low amounts of exercise will reduce the chance of any further types of kidney stones for Peter. Next, I'll be discussing pain management for Peter. Peter is currently experiencing acute pain, which is treated by certain medications, which we did discuss earlier in our presentation. The nurse will be monitoring changes in Peter's pain by measuring his, firstly, vital signs, secondly by using a pain scale, which would generally be every 4 hours, but can be going to as low as one every 1 hour. And at the bottom you can see an example of a pain assessment tool, where it's on a scale of 0 to 10, with 10 being the worst pain possible and 0 being no pain at all. And thirdly, verbal communication with the patient, in this case Peter, is extremely important to see what type of pain they're currently in, by asking them questions about where the pain is located and also what type of pain it is, so the nurse can grasp a better idea of what Peter is currently experiencing towards his pain. Also with pain management, Peter is currently experiencing some type of nausea, and a fluid balance chart is generally used by nurses to measure the amount of fluid that Peter would be using or the patient is losing due to vomit, as well as checking the skin turgor and mucous membrane, as well as continuous assessment of Peter's nausea will be important in this situation. Finally, for pain management, as I did stress before, continuous pain assessment is essential in this case. And other options that the nurse can use to help reduce Peter's pain would be positioning Peter Piper in the most comfortable position, which is generally upright. But some patients with renal distress generally do like to be in a hunched position to the side because it is the most comfortable for them, which is also okay. And as I did stress before, medication is the most effective for pain management for renal calculi, and in this case it is just acute pain, so medication would be the best option. Monitoring and managing complications. Continuing assessment is, as I did stress before, is extremely important, and in this case the nurse would need to discuss warning signs with Peter. So that includes warning signs when he might be thinking he's getting renal calculi again, like the certain type of pain he'll be experiencing. As well as this, a collaborative approach to healthcare, which includes Peter and his family, is extremely important to allow for holistic care. This will include discussing with Peter what might initially have caused the previous stone, and secondly, discussing ways Peter can adapt to his current environment. This includes adaptations to his work lifestyle as well as his lifestyle at home, and this will also include Peter's family because they will allow the best chance for any changes to reduce any chance of further kidney stones for Peter. Finally, we'll be discussing patient education for Peter. This will allow for overall better health outcomes for the patient, and in this case the nurse will discuss and educate Peter and his family on initially risk factors. This would include any lifestyle or dietary risk factors. Secondly, who to contact if symptoms do persist. Thirdly, how to reduce symptoms and overall prevalence of kidney stones. And finally, having a mutual intelligibility approach, which does mean that everyone's on the same page and agreeing with Peter's current care.